My name is Nancy, and what brings me in today is I'm getting a breast aug. I'm also getting some lipo and some transfer to my hip tips. I chose him because I love his results. I've seen his reviews, and he has excellent reviews, his confidence, and just his results with his patients. Well, I've been wanting it for a few years now and just waited until the right time, which is now. I am getting older, so why wait so long? Summer, wearing whatever I want and just being more confident in myself.
Interesting case today. We got a lot going on. So this patient's previously had a tummy tuck done elsewhere and then a BBL done elsewhere as well. But now she just wants a little bit more hip projection and a little more volume on the top of her butt. So we're going to touch on a couple areas that she hasn't had lipo before, including her arms and her upper back. So whatever fat we get from there, we're going to take and inject that into her hips and butt. In addition, she has some flat spots on the bottom of her butt, and so we're going to address that with Aveli, which I've been using now for about 3 years, and so it's great for cellulite. Sometimes you have cellulite before BBL, sometimes you may notice it more after BBL, but thanks to this little device, we can go in and release some of those selectively tight bands, which are causing a lot of those flat spots on the butt, and this will help give more projection to the lower portion of the buttocks and smooth it out. In addition, she's about a cup and she wants to be more of a C cup, so we're gonna do some Motiva ergonomics, about 380 to 360 cc implants above the muscle in a subfascial plane, just to give her that little oomph that she's looking for. In addition, I'm gonna do a small little scar revision on her tummy tuck scar as well. Alright, so this is what the Aveli device looks like. We were one of the first people here in Beverly Hills to use this a number of years ago, and basically I pulled this little tab out and we have this light that comes on, and when this light is under the skin, it shows me exactly where the cellulite band is that I'm aiming for and how I'm going to cut it. So I push one of these buttons and then I can actually hook the cellulite right here, and then once I have confirmation that that cellulite is hooked, then I push again and a small little blade comes out, and then I'm able to pull and cut that band and then release and then go find the next band. So I find the next band, I pull out the little hook, and I pull back to confirm that I have the actual band, and then I push down, a little small tiny little blade releases, and then boom, I cut that band. So that's how cellulite is released with the Aveli wand. I rarely ever do Aveli with the BBL. 99% of the time we do Aveli awake within our clinic on certain days of the week. I typically won't do Aveli with the full BBL because it's a lot of trauma to the underlying skin, but in today's case we're mainly focusing on the hips and the upper butt, so we're not going to be injecting fat wherever we do the Aveli. But otherwise, I'd recommend you do it about 3 to 4 weeks before your BBL procedure. So for today, basically we're doing superficial release of some of these cellulite bands, which we've marked out here. These are some of the areas where they're nice and where they're really concentrated, and so I'll go in with this Aveli wand, release those bands. Over the next few days, she'll see an immediate change as those bands have been released. The swelling takes a few weeks to go down. Post-op, we don't want you working out for a couple of weeks. If you're not getting a BBL, you can put direct pressure on there right away, because that will help to decrease some of the swelling and get all that extra tumescent fluid out. We also put a pair of compression shorts on you that you're going to wear for several weeks, just to help all that swelling and everything else come down. People often ask, how long does it take to see results after Aveli? You'll see results right away, but you need to wait for all that swelling to go down, which could take up to 2 months on average to see all that swelling go away, and then you'll see the full effect of the Aveli. When we do this procedure in the office, you're only in our office for maybe an hour to an hour and a half. We do this completely awake under local anesthesia, and you can drive yourself to your appointment, you can drive yourself home, no issues. You can even go back to work that same day. We just ask that you don't do any strenuous workouts for a couple of weeks. So by hooking the band, I can see exactly where that dimple is, and so now I have the band hooked, but the knife is not released, and so I see there's a strong dimple there. So now I'm going to push down and release the knife, and then I'm going to pull, and that kind of releases that band. So people ask, what are the risks of Aveli? Well, it's a pretty safe procedure. We're staying really superficial. We're not going anywhere near the muscle. So we're just targeting those cellulite bands underneath the skin. Some of the more common risks are bruising. So we ask that you don't drink alcohol for about a week before the procedure, along with taking aspirin or any of those other blood thinning type medications. So make sure you tell your provider if you're on any certain medications which could cause bruising, because we don't want that bruising to become permanent. If you overdo the Aveli, you can get skin laxity or you can get drooping of your buttocks. So there's a fine line between taking too much of the cellulite bands or taking just enough. In addition, you could get seroma, and that's a buildup of fluid. After this procedure, we do recommend getting a few lymphatic massages to really help push all that extra fluid out. As you can see, I've put a lot of tumescent fluid in, and we want to push all that extra fluid out like that. By getting all that fluid out, that will help the swelling go down a lot sooner, help prevent seromas, and help that nice smooth contour come to the surface. So I've completely released the bands on both sides and all these kind of little purple areas, including a little bit on the back of the thigh here. So now what I'm going to do is I'm just going to try and push out any extra fluid. Sometimes you'll see a little fat come out with that as well. But the goal is to get all this extra fluid out so it doesn't build up inside of you and you end up with seroma. All right, so very petite patient. We only did lipo for her arms and her upper back. So just with those two areas, I was able to get about 750 cc's of fat. She's only 119 pounds, BMI is 21. She's already had a BBL with Lipo 360 before, so the fact that we even got this much fat is impressive. So I'm really gonna focus on putting most of this into her hips, that's where she wants it, and just maybe a little bit at the top of her butt. All right, so we finished up the back. So basically I did liposuction to her arms to make them a little bit more petite and nice and contoured. Did liposuction to her upper back, and then just put a little bit of fat into her hips and very much top of her butt. Not a whole lot of fat, just had about 700 cc's to work with, but still sometimes a little bit can go a long ways. All right, so we're getting ready to start the breast augmentation. A couple things I do to help keep you and the implant safe. Number one is I always use some sort of nipple shields. The nipple has a connection from the inside to the outside, and they can harbor bacteria. So I never do the breast augmentation around the nipple, and I always cover it with a nipple shield. Number two, I use an incision in the inframammary crease. This has a very, very low risk of capsular contracture or when scar tissue forms around the implant. It's slightly higher in studies when you put the implant in through the belly button or through the armpit or through the nipple. So with this incision down here, I get a very, very low rate of capsular contracture. When we decide on where to put the incision, we have to think of a couple things. Number one, how far is the distance from the nipple to the fold, and what size implant are we working with? So you never want to have an implant that sits really high up here and the nipple really too low. So there's a lot of planning that goes into doing a breast augmentation. It's just not a matter of making incision and stuffing something in. There's a lot of analysis on how wide the chest is, what kind of profile the patient's looking for, what's the ultimate look they're going for. And we combine all those things together to determine what implant's going to be best for you and give you the look that you're going for. So sizers are an important part of breast surgery. It helps us to determine what implant will fit and what looks the best before we put the final implant in. So these are sizers. They come in, they come out. They're just like the implants. They're the same texture, the same feel, the same size. And so we use those to get an idea if the size that you want will actually fit, or do we need to go with something else. So today I'm using an internal bra mesh. So the reason why I'm doing this is because she is choosing an implant that's fairly large for her size. And so I want to support that implant from dropping below where it's supposed to. So the mesh will help reinforce that fold at the bottom and provide long-lasting support. I typically do this in patients who choose larger implants, especially when they have very petite frames, such as this patient today. So this part of the mesh will sit against the chest wall, and then this will wrap around to the front of the mesh. So it's going to create like a little hammock for the implant to sit. So the implant will kind of sit like this in a hammock. But this will help reinforce and support the lower portion of the breast. Alright, so here we have the implant. First thing I'm going to do is I'm going to put a little bit of saline around it just to take some of the friction off of the implant, which attracts particles, and then I'm going to put some betadine in there, which is just one of my preferred antibiotics. So now the implant is in, and this mesh is going to wrap around the implant. We're going to suture that in place just for a little bit of extra security. The implants are seated nicely now. She's going to have some really good cleavage. You want it to be more of a C cup, so I believe that we achieved that today with Ergonomics Motiva implants. So the final last piece of the puzzle will be, we're just going to revise her scar. Just going to take out a little bit of the scar there and reclose it, and then we'll be done. So I'm doing a scar revision to her old tummy tuck scar, which was done elsewhere, but there was just a little portion of the scar that she didn't like. So I've removed a little bit of skin, and you can see how much the scar opens up. So the goal is to continue this scar in the same plane and line as her old tummy tuck scar. So the way I'll do that is when I close, I will anchor the skin down to the fascia. This is her fascia, which gets repaired and plicated during a tummy tuck. And so I'll kind of keep it in the same plane as her old scar, and that'll keep this nice curvy linear type scar. I may even bring it just a little bit lower because her current scar is a little high. This red line is where I would typically make my tummy tuck scar, but hers is a little bit higher. Okay, so we're all done with our case. Did liposuction to the arms, liposuction to the upper back, Aveli to the lower pole of the buttock for cellulite, fat transfer mainly to the hips and upper portion of the buttocks, subfascial silicone breast augmentation with Motiva Ergonomics moderate profile implants, 380 cc's on the right, 360 cc's on the left, and did a tummy tuck scar revision. So all done, and I believe she's gonna look great.